Just so you'll know, Montefiore has actually put together some amazing trifold, which will not only tell you the kind of documents you need to have with you when you come to meet with your navigators, but also give you some more detailed information that you can take back to your neighbors. And we have that information both in Spanish and English. I know we get a lot of questions because it can take up to maybe an hour, sometimes 45 minutes. I understand it's the standard time, but if you have somebody who is language deficient, it can take up to 2 hours. Is that correct, Amber? Okay, and I just want to focus and be a bearer of not so good news, but of course the marketplace is not going to cover everyone. For example, the marketplace does not cover undocumented individuals. It's important that we know that. However, children of undocumented who are 19 and younger will be covered. So we don't want people to feel that because they're undocumented, their children cannot be covered. It's important that we let individuals outside know this. Also, incarcerated individuals are already being treated. So therefore, as an incarcerated individual, these are individuals who don't have to sign up for the marketplace. Uninsured individuals that have access to affordable health insurance. The reason why I say that, because even some of the staff, you hear the premiums are so low, you're so tempted to just go out there and get on the marketplace. But if you have health insurance, the state wants you to keep your health insurance. Therefore, if you go on the marketplace, you may find yourself paying a little bit more than what you're paying now in monthly premiums and co-payments. And only if your employer-based coverage does not exceed 9.5% of your income are you able to go to the marketplace. Is that correct, Calvin?
That's correct. That's a very important point that I failed to mention. That's the affordability standard that's set in the law, that if your coverage is, if you're paying more than 9.5% of your income for coverage, you can come to the marketplace and try to seek more affordable coverage, and you may also qualify for tax credits. Anybody can come to the marketplace. The issue is whether or not it's advantageous for you to do so. So if you're getting coverage and it meets that affordability standard, you come to the marketplace, you will not qualify for any tax credits, and most likely then you'll find that the premiums are exceeding what you currently pay.
And the reason for that is because the law was passed as a tax law, it wasn't passed as a health law. We know this was tried under President Roosevelt, and it was tried under President Clinton, and it wasn't until we got to President Obama that it actually became possible for us to have affordable health coverage. Certainly prior to this administration, 1 out of 5, I would say 3 out of 5 bankruptcies were due to exceedingly high medical bills. So now people don't have to give up their homes if they happen to get sick, because I know if I have a relative who's got, God forbid, cancer, I'm not going to let them suffer if it means putting up my home. So now we need to understand that because it is a tax law, if you have health coverage, this doesn't mean you have to give it up. If you have it, keep it. We hear people are going into this frenzy, oh, what's going to happen? Well, if you have health coverage, keep it. We want to encourage people to keep it. It's working. Your employer's providing it. You're not paying over 9.5% of your income. This is good for you. There is nothing for you to worry about. We don't want people to hit the panic button. And certainly, if you are an individual who has Medicare, you're not going to be able to go on the marketplace because this is the Platinum Plan. And obviously, if you're 65 and older, just with some exception, and please correct me, and individuals that are over age 65 that do not and are not eligible for Medicare can go on the marketplace. So if you're over 65 and you're wondering why wouldn't someone be eligible for Medicare? Reason for that, maybe you didn't meet your quota. You know, every year you have to be able to meet certain standards of how much credit you have within having paid into Social Security and being able to get that. So if you're 65 and over and you don't qualify for Medicare, certainly this is where you want to go to the marketplace. And if I may also add, that individuals eligible for Medicare can purchase on the exchange coverage, but they would not be eligible for subsidies. So these are some points we want to keep in mind, and I will close my presentation with just once again informing you that we will have certified application counselors through Montefiore. We're going to try to get more people trained as certified application counselors, but we have some wonderful navigators here, and I've actually printed up our state website for Westchester County, and I will be putting that information back there. We have some bags for you to just fill up with some really informative material that we want you to take back to your neighbors and let them know that this is not as complicated as many people would like to think, and we are going to make sure that we exceed the numbers and we break the record here in Westchester. Correct? Okay.
So, do you want to, could you just identify the pamphlet that, I thought that was very good.
Oh, yes, and if I may, Ms. Parker, the pamphlet, no, the one you have in front of you, the trifold. This is probably me going back into my older years of government. We've made it sort of like a palm card, so it's a trifold. It's very easy for you to hold. And basically what the information here is not only gives you the key dates, but also the checklist, what you need to bring with you. So you don't have to worry about taking all the notes that are all the information that's being given to you here in this presentation. You just take one of our trifolds with you, and you yourself check off the information you have with you to make it easier for your navigator or for when you go on site to try to enroll. So again, we have the checklist, we have the requirements that you need to meet in order to access coverage. For example, you must live in New York State. You can't live in New Jersey and come here and try to sign up. That's not going to be possible. And also the different immigration rules that apply. That's very important. And emergency Medicaid is still available. So even if someone is undocumented, emergency Medicaid is still going to be made available. So again, this is something that's going to take some time, but we're certainly looking at this in terms of being around during a very historical period, sort of like people that were around when Social Security was first introduced. So we can definitely tell our great-grandchildren, our future generations, that we made it happen. Thank you. Yes.
I also would like to add, Mount Vernon is very fortunate in that we do have a federally qualified health center, which is the Mount Vernon Neighborhood Health Center in this community. So for individuals who are undocumented, they can go there for some primary care services, and they also have certified application counselors there. So Montefiore, in partnership with our other healthcare providing agencies in the city of Mount Vernon, are working together to ensure that as many people in Mount Vernon that can be covered are covered.
And also one exception to the living outside of New York State. So if you live in New Jersey and you work for a small business in New York State that comes to the marketplace to get coverage, you may purchase coverage in New York State under that small business option. That's the exception. But they can also choose to purchase in the state where they reside.
Thank you. Let's put your hands together. That's the wonderful presentation. Parker, are you going to make a presentation?
Well, I could just talk we could just take questions, or I could just talk real quickly about what's
you want to come up?
Sure, absolutely. I don't know that I need the mic.
It's right there.
I'm not good with mics, but anyway, so I couldn't pass up the opportunity just to talk about this really, I thought about all these adjectives to describe this process. It's been exhilarating, exciting, thrilling, it's been frustrating, it's been overwhelming. We started as a navigator agency with about five navigators full-time on October 1st, and we weren't prepared for what I think is the response, the overwhelming response of Westchester residents to the opportunity to get health insurance. We were, I think at one point we were fielding about 40 to 50 calls per day. We had to run out and hire a temp, just someone to man that information line. Amber Wilson is one of our navigators, and we've done over 700 applications, I would say, since October 1st. I mean, I'm not sure how many individuals that represent, but 700 applications in a brand new system, a brand new process was, I mean, I think incredible, and I really, publicly acknowledge the work of my staff, and just, we've worked weekends. We're in 27 sites throughout the county. We do county-wide services. We work weekends, we work evenings, we work on a Sunday, we do presentations, we have radio shows, we talk shows with the mayor, the mayor's talk show. But we have been very busy, extremely busy, in getting the word out and responding to what I think is a greater than anticipated demand or need for assistance. So I just wanted to say that, and then, of course, we'll take questions about any sort of nitty-gritty any piece of the process that you would like to hear more about.
Thank you. Thank you. Okay, we'll move to the questions. I know the mayor was here, Mayor Davis, and I know he might have had to leave. But we really, really appreciate the mayor showing up for this important forum. Now, questions.
Has any research been done up until now on the percentage of doctors that might not be participating in this program because they might feel that they're not getting enough money, the fees not going to be higher?
I don't know of any specific research that's been done. Perhaps there has. Okay, for the audience, he's asking if there has been any research conducted to give any indication of the percentage or number of doctors who may decide not to participate for various reasons, whether they feel like they're not being reimbursed at the right levels, et cetera. And my answer to that question is I don't know whether or not such research has been conducted. I'm not aware of any particular studies that I can point you to. So, well, it doesn't mean that it's not out there. It doesn't mean that other people haven't done it. I just personally do not know the answer to that question. So I can't tell you that definitively that has not been done. Certainly we've worked with various physician organizations. We have regional advisory councils across the state and physician organizations and groups. We work with the Medical Society and various other types of organizations have been involved in those processes and informing kind of what went into building this operation. So there has absolutely been input from the physician community. Doesn't mean that every physician is absolutely thrilled with what they're seeing. But to your question, I cannot point you today to a specific study that has been done. The state conducted a number of different studies using the resources of Wakely Consulting Group and also the Urban Institute. I don't recall any of those studies focusing specifically on physician groups.
Also, Dr. Hollingsworth just asked me to once again remind everyone that hospitals do take Medicaid, Medicare, which are pretty much what a lot of these plans that are listed as qualified health plans. So that's something to bear in mind, that of course the hospitals do take these plans, they do take Medicaid, they do take Medicare. So even if they're not in the qualified health plan, the hospitals are taking these plans and people will be seen and cared for.
On that point, most of the providers that you offer, that you had their logos up there, those providers also participate right now with doctors. Most of the doctors participate in those provider programs. I mean, I know a lot in Westchester County, and I know probably in the state of New York. So it is likely that if they're participating with a, let's say, United Healthcare or another insurer, not provider, I should say insurer, that they should not have a problem with really, or I guess the problem would be the reimbursement rate that they would get under this program versus outside of this network.
That might be, yeah.
Yes, and also, just so that we can touch on another point that Dr. Hollingsworth mentioned earlier, which is the qualified health clinics, the federally qualified health clinics, which What it means is for someone who may not qualify for the marketplace, let's say someone is undocumented and they need preventive care, they need to see a doctor, they need to be treated, they pay according to a sliding scale, which is based on what they can prove in terms of where they work and how much they can afford to pay. And that's what's so great about the federally qualified health clinics, that it does provide that option. The whole reason for the Affordable Care Act is to really encourage everyone to empower themselves by taking care of their own health care needs, because it's a lot easier to be able to address an issue from a preventive standpoint, taking care of yourself, not taking care in terms of medication, being compliant with your medication, so that you don't end up in an emergency room. For the most part, people were using emergency rooms as their primary care facilities. And the only time they ever came to the emergency room were when they were critically ill. It's important that we understand is that everyone has to do their part. Patients have to do their parts. We have to encourage our loved ones, and we ourselves have to go in for those preventive appointments, yearly checkups. I know when I started at Monte, I didn't know I was predisposed to diabetes. And as a result of an AC1 test that actually documented my blood sugar levels for 3 months, I was able, and I was told that my levels were so high that a 0.5% more I could become a full-blown diabetic. And that allowed me to take some preventive measures within my eating habits that would ultimately impact and prevent me from developing a detrimental illness that can cause me blindness, it can cause me amputation, things of that nature. So again, this is about taking care of ourselves and being able to, it's not a fee-for-service, it's about prevention, and it's about preventing those emergency room visits by taking care and taking advantage of the healthcare provision that's been made available.
I just want to add that although this is not official, it's sort of anecdotal, but we find that when individuals select a plan, in order to select a plan, we usually recommend that they find out if their providers are participating. And it's very rare that we find that someone is not able to find their providers in one of the plans. So it's not an official study, it's no official thing, but I'll just say anecdotally, we don't have a lot of situations where people are not able to find their doctors in the plan.
I work with a church organization. If we were to do a presentation corporately, are these navigators available to be on site, let's say, on a weekly basis, you know, and given the deadline between now and March, the end of March, on a weekly, regular basis, so these individuals in, let's say, the church circle can access and join? Are they accessible in that kind of model?
We have been putting out the word for every single navigator agency and certified application counselor in Westchester County to come forward, because we are inundated, we are overwhelmed. We have five individuals and that are completely booked at every single site that they are currently located. So what we've been doing is just having people, you know, maybe in your community that meet with navigators. We have navigators in Mount Vernon, in Yonkers, in White Plains, in Almont, in Montefiore, and you know, throughout the county. But there are still only five individuals. It's possible that if there's sort of like a forum or workshop that on a Saturday afternoon that could take some overtime and have them come out. But there's supposed to be 107 navigators and certified application counselors in Westchester County, that according to the list. I'm not sure if all the certified application counselors are trained. You know, I'm not sure, but we tend to get a lot of calls. So we can talk after to see if there's something that we could do, or if there's some way to connect your community to the current navigators and the sites where they're currently located.
First, I want to mention that they printed out here for you the site locations for the navigators that are, so this is Westchester County-wide, all of the navigator organizations, all of the sites where they're available. If, for instance, Westchester County Health Department can't have a navigator featured at a particular site,
It is possible, and you'll find phone numbers here, where you can call the other Navigator organizations and see if they have someone available to come and be at a particular site on a regular basis. So that's an option as well. I'm hearing that I should mention, in addition to the 4 levels of plans that I talked about earlier, that there's also a catastrophic plan that is available for individuals under the age of 30. So they can select a catastrophic plan. However, I should mention that there is no assistance, there's no financial assistance that is available for catastrophic plans. So you may find, and I have done this just playing with the estimator, in some cases, the catastrophic plan actually might be more expensive than if you were to get a silver level plan that covers a lot more, and you can get some, it's only at, you have to be at the silver level to get the assistance. So you may find that you can purchase a silver level plan and get financial assistance, and it'll actually be cheaper, and you're getting more coverage than you might get on the catastrophic plan. So don't automatically assume for those under the age of 30 that that's the place that you go, the catastrophic.
I think, Joan, you had a question,
Yes,
and then
I
Joan.
do. I have a question. Many of the plans have eliminated the dental plan. So if you are currently under a plan, can you then get a dental plan under the New York State Health?
So if you have, are you talking about coverage that someone may have through an employer right now?
Or through Medicare?
Or through Medicare?
Yes.
So you can purchase standalone dental coverage here through the marketplace, if that's the question.
Yes.
But it's not a part of the mandatory
Right, it's not one of the required benefits that every standard plan, every plan on the marketplace must offer. So I talked about 10 essential benefits required by law in every plan. The dental coverage that you're talking about is not one of those, except for in the case of pediatric dental and also pediatric vision.
So do you get any tax credits for it?
No.
The
For the dental plans, I don't know.
plans in the marketplace are $11 a month. They have flat rates in the marketplace. And you can also search on the website to see the list, the website for HealthPlex and Dental Smiles, I think. You can search on the website for their plans.
I think there was a gentleman here, and then, okay.
Oh yeah, actually just a statement regarding the question. As regards to the dental plans, I think you'd have to choose a medical plan before you can actually get to the accessing of the dental plan.
Right.
So I don't know, I'm not sure if you're able to actually say, okay, I'm just going on to the healthcare site just for a dental plan. I'm not sure if that has changed.
Oh, it has to be
Well,
within.
in the process of doing the applications with clients, we haven't seen where you can just choose a dental and not a medical. It's after you choose a medical that the dental option pops up.
No, so that's my question. If you have the medical plan already.
Yeah, if you
but
can't
it
choose a
doesn't-
dental, I don't think you can.
They don't, you have to search, you have to look, he's right, you go through the process. It doesn't just say, do you want dental?
Only.
So if someone, I think what you're referring to is if someone has a health, you have through your employer or Medicare, for example, and you don't have dental, can you just go into the marketplace and buy dental? And I think the answer, I think we need to clarify, but
Actually, I'll need to clarify that, because early on we were talking about that being standalone, where people could actually go in and purchase that dental coverage standalone. But let me check into that, figure out how I can take your information and get an answer back to you.
On the portal, on the portal itself, no. I'm just saying, based on what we've done, you can't. You have to choose a medical plan before you can access it.
So in other words, you have to be a part of a medical-based plan, and then as a part of that plan, you can elect in or out of dental. Is that?
Yeah.
I just don't know whether that you can do it by calling the I think we need to double.
The health plans that are offered in the marketplace, though, they offer those individual, for someone who has employer-based coverage or Medicare, you can go to the same website that's offered through the marketplace and get an individual plan. Like when we were community health advocates, you can purchase standalone dental plans.
But maybe not at the rate in the market.
They're around the same rate.
But we'll definitely clarify.
Oh yeah, just to also clarify, I don't know if you said it, but for the CSR, the cost share reduction, where you get the co-pays and the deductible reduction, it's under the silver plan. I don't know if you said that clearly. I don't know if you said it. Was only under the silver plan. I don't think you can get that on the platinum or any gold or bronze.
In other words, the cost sharing will
Cost
only be
sharing
on the
is
silver.
only on the
Only
Okay.
applies to
silver
silver
plan.
plan.
Okay.
It's
And
not
so,
like your co-pays and deductibles be reduced.
would be reduced, but, okay. Do you know why that would be as opposed to being on either the lower or the higher tier plan?
That's why they're not offering the, I'm not sure exactly why they decided to do it that way, but it is based on the tax credits and those subsidies. I think they're based on the second lowest costs of the plan.
Right, just the
But
cost
anyway.
sharing, the tax credit
Itself
can be all.
can be all, except
But the
for-
cost sharing, deductibles,
except the
co-pays, and
catastrophic.
co-insurance
Right.
are only on the silver level plan, only outgoing.
Did everybody understand? I know we've got a lot of people talking here.
It's based on the federal poverty level. So, the silver plan was established based on 400% of the poverty level, and that's where the balance was determined that supplemental need was provided. So, if you're above that, then there isn't that benefit. You're not getting the tax credit because you're above 400% of the federal poverty.
Rather than the gold plan, wouldn't the gold plan also be on the federal
I can answer your
poverty level?
question about the federal. So the silver plan with cost sharing reductions is between 138%
Right.
and 250% of the federal poverty level, where you can get those cost sharing reductions. So if you're above 250, you can still get tax credit, you just can't get cost sharing reduction. So it's only from 138 to 250.
Right, so if you're above, so you are 138 to 250, 0 to 250, you can get help, pretty much, in the form of a tax credit or cost sharing. If you're above 250, up to 400, you can get tax credit only. And if you're above 400, you just get the marketplace rate, which is 53% less.
I understand that. I just don't understand why you wouldn't get it on the lower plan, which is below the,
Like bronze?
no, the gold plan is below the silver, right?
No, the gold is silver.
Oh, the silver is,
It would only be
okay.
it would only be the.
I'm reminding you, okay, great. Now it makes sense.
I think one of the bigger reasons, because again, I think this might be just an assumption really. I think one of the bigger reasons is because they believe that most people would fall within that, the
Yes,
choice,
we
of
believe
choosing,
that, yes,
the choice
yes.
of a silver plan. Most people
Yes.
want to choose a silver rather than a gold or a platinum or
Well,
a bronze.
affordability, I mean, it's based on affordability.
Right.
Obviously, if you are within the range of the federal poverty level, you will not probably be likely to afford the platinum or gold plan. And so the benefits actually flow to
There is a reason for it based on the matrix, but I don't know the exact reason, but there was some methodology used in order to select the silver plan.
It was-
And also, if they get the bronze plan, they don't get as much, they're not able to get that tax incentive. Is that right?
You can use it. It's more, if you compare your costs, if you qualify for silver with cost sharing reduction, and you compare the cost you would pay for platinum or bronze or gold, it doesn't end up being advantageous for you as far as your cost. Because for platinum, you're going to pay more for your monthly premium, but you don't have a deductible. But for your silver with cost sharing reductions, you would pay less and you would have a smaller deductible.
But
So
the
you
best,
can compare them.
to sum up, I think the best bet would be to go online and actually test it through your, the template you have, right? I mean,
tax credit
all the
and
plans,
premium
right?
estimator,
Yeah,
you can
and decide which is the lower.
That's where you fall. It's not gonna show you the cost sharing subsidies, it's gonna show you the tax credit.
And also, I'll let Ms. Parker also elaborate more on this. It's important that every individual is different. So let's say someone who may need more doctor visits may look into a plan that will cover more doctor visits. Maybe you're someone that can anticipate being hospitalized because maybe you have asthma or some other pre-existing condition, which is one of the reasons why this health law was passed, because a lot of people were being rejected because of some pre-existing condition. So again, this is not a one-size-fits-all. This is very individualized, and this is about us also encouraging people who are signing up for the marketplace to sort of like make a list of what their medical needs are, what they anticipate, and also be very forthcoming and understand that this is what's gonna help you in terms of getting the best plan that's gonna meet your needs, is you're not gonna be rejected for pre-existing conditions. So mention that if you have a mental illness, you don't wanna have a lapse and because maybe you're not getting the right coverage that's gonna provide you all the medication that you need and things of that nature. So again, this is not a one-size-fits-all. It's a very individual process, and it's all about the individual understanding what their needs are and communicating those needs effectively to that person that's assisting them with enrollment.
I thank you for saying that, and I agree 100%. We find that more people apply and get to the decision phase, right? I mean, that's the easier part of the process. And then selecting a plan becomes where most people need to, and we really, say, listen, this is about your health needs and your pocketbook. So somehow, there needs to be some sort of assessment as to what level of health care do you need and what you can afford. And that, is definitely on an individual basis. I mean, I wouldn't get too caught up with the mental cares and all that stuff. Listen, what are your health care needs and what can you afford? That's an individual thing. That's something that we try to help people with. We say, go home, sit down, look at your, health care needs for last year. How much do you pay for things? How many meds do you take? How often do you see the doctor? How many tests do you get? How many lab visits? We went this, blah, 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 blah. And then look at what you can afford, and then we can fit into a metal tier. But the metal tier does not come first. Your needs and your affordability comes first, and then the metal tier.
Okay, I think we have.
I just had a question, just to clarify, because there's so much talk now. If someone decides not to, they have no insurance and they decide not to enroll, I mean, I hear all these different things. There's penalties. The first year, there's a penalty, and each year it goes up. Is that correct?
Correct.
That is correct. So the law stipulates that every person must show that they have health coverage. And if they do not have coverage, so if you don't have health care coverage and you did not get it this time when you complete your taxes for 2014. So in 2015, when you're doing your 2014 taxes, the IRS will assess a tax penalty. It's smaller now in this first year as we're just beginning this effort, but each year that is expected to rise.
And one more question that I had about that I can't believe this would be true. If you have benefits provided through your employer, is that considered some sort of income?
You don't need to apply.
Yeah, I know I don't need to apply, but is the benefit that your employer gives you, a portion of it, is that put towards your income?
In terms of
Oh, you mean in terms of it's your annual taxable income?
Yes.
In terms of determining what you qualify for? Is that what you're asking?
No,
Added to your income.
I think that
like if my employer gives me 60% of my insurance and I pay 40, do I have to add that portion that my employer is paying for as income?
Presently, you don't have to do that, and I don't think that this law changed the existing law with respect to what is taxable income.
But you've heard it too, though.
Yeah, I've heard that because there are a lot of, you're right, there's so much information out there, some of it misinformation about the program, and others are just people speculating.
Right.
And you're right, if the person has not, right now, if you didn't purchase, before the Health Care Act came into play, if your employer contributed to your insurance plan, and they did that because most of the times the employee pays a portion and the employer pays a portion. The portion the employer pays is not taxable income to the employee prior to and the healthcare law didn't change that. The only change I think occurred with respect to taxation is the penalty if you are not in a program. And I think there's some exceptions to that. There's some exceptions to that.
Yes, I just want to go over some of them. So if people with a household income below a tax filing threshold are exempted. Also, people who had hardships trying to purchase insurance, for example, buying insurance would cause a serious deprivation of food, shelter, clothing, and other necessity. They're also exempted, and also individuals who, with coverage gaps less than 3 months. Most important that I have to, again, emphasize is the fact that people with a household income below the tax filing threshold are not going to be penalized. I know that the first year, things may seem somewhat lenient in terms of the penalties, the tax penalties, but I can assure you, as time goes by, those penalties are going to increase. I know that by 2016, an individual would have to pay like $695. A family of 4 would have to pay $2,085. Sometimes it's cheaper to just get the health plan. I mean, think about it. If you're driving a car, you're expected to have insurance, right? So if you're driving your body, you're walking around, you shouldn't have insurance.
But if you were to give the
Yeah, I don't
reason,
think
I
it's
mean,
an
I think that
expectation, it
the
was a
issue.
question, because some people say paying the tax is cheaper than taking the insurance. I mean,
Now,
that-
but it's
you're
going to
right.
be increased to the
I
point
mean, I
where it
have
would be more
insurance, but
beneficial.
But it still doesn't deal with the most important issue of you're healthy today,
Yes.
you don't know what's going to happen to you tomorrow.
But I think that if
That's
you
why it's insurance.
if you try to look at the reasoning behind why is it that there's a penalty associated with not purchasing insurance, why is that? And you have to think about why that is. Why that is that you're going to be, first of all, if everyone does not have insurance, the situation that was mentioned earlier about getting to the emergency room and actually getting in a very serious illness and going to the emergency room, and now they have to treat you. They can't say, well, we're not going to treat you. There's a cost, a huge cost associated with that, and everyone bears that cost. So I think that what the theory behind having a penalty to say if someone can afford, I mean, because the exceptions take people who really would not be able to afford the insurance. If you can afford the insurance and you decide that you're going to play a roulette, and if you get sick, the costs actually end up on society and everyone else. So they're saying that's why there's a penalty.
Nonetheless, to say the backup
Yeah.
causes in the emergency room departments when you really have an emergency going on in there.
Yeah. Yes.
Also, quickly, just to mention that, you can't just decide yourself, I have a hardship, and so I'm not gonna, you actually have to complete an application and be proven to have a hardship to get that exemption. There's also a possibility of a religious exemption as well.
The members of certain religious groups who object to having,
There are also members of certain religious groups who object to having private or public insurance coverage on religious grounds. So, for example, Native Americans eligible for care through the Indian Health Service is another group that's exempted. Did I pretty much cover it? Yeah. Okay. So, if there's any other questions?
Any other questions?
Well, it was really just a statement. I'm sorry, I'm saying someone else. I'm sorry. It's really just a statement to again about the penalties that exist. I think one of the things that we use in getting people aware about the penalties, especially telling them what the penalties are. People. I think most people hear the dollar amount, which is $95 for an individual. Then what we say to them, well, actually, they take either that dollar amount or the 1%, whichever one is higher.
Right.
So that dollar amount of $95 might not be the higher of the two. It might be $250 of whatever your annual income comes up to. So we kind of, in terms of educating people on that.
Right.
I have a question.
Of your annual
If we can let this gentleman here answer his
Yeah.
question, his hand's been up forever.
I actually had a statement. The reason why I had a statement is because navigators were speaking about how they're overwhelmed. And we've been actually going through the process of enrolling people. We are CACs of the Mount Vernon Neighborhood Health Center. Right? And what we've been doing is we've been getting many people come in, and we've been going through the process very easily. So if you ever need any help or assistance, we are there.
We do.
We have about almost 19 CACs, certified application counselors, And we go all over the place, we work with community centers and that.
We do make referrals, we have been making referrals to the health plans and or we also have certified application counselors and to the neighborhood health centers.
And I should also mention that we're still training more certified application. There's still
Where can
training.
people go to get
So,
trained?
I just want to.
Dr. Holmes?
I just want to make sure that everyone walks away from this with the understanding that regardless of whatever action someone takes, whether or not they decide to play roulette, which I do not recommend, whether or not they enroll in services, that they still will be able to access care through any one of the facilities that they choose to engage with. All the facilities have financial aid policies. They're all published. They're on our websites. We've got them posted. All the instructions are there. So I don't want anyone to be afraid that New York is going to become one of those states where if I didn't make this decision now, then, oh no, I'm just going to have to suffer and I'm not going to be able to get care. You will still be able to get care. There's just a better way to go about it, and that's this.
I just have 2 points that I think I'd like to be addressed for. In terms of the application, can the application be defined? You can just address that.
Are people denied?
Yes.
No, I would say for the most part.
Yes.
I'm sorry. Depending on, there will be denials because someone does not provide information, enough information, or because, let's say, someone has equivalent employer-based coverage, so they can't get a PTC. But I have not seen you cannot apply. I mean, I know that there's some people who cannot. We're not allowed to apply like undocumented, to get coverage like undocumented. But so if you can apply, right? If you're eligible to apply. I don't know that I have not seen a denial. I've not seen a denial. You might not get coverage because there's documents that you need to upload, but there's no, you cannot unless you weren't one of that meet the criteria to apply in the first place. But if you meet the criteria to apply, right, then there should not be any denial. You might not get tax credit. Or you might not qualify for a tax credit. You might have to pay the marketplace price. And some people choose not to do that because it's somewhat costly. I do want to say though that the application process, it's a systems verification process. So for the most part, except for some exceptions, information is verified, checked against IRS and Social Security Administration, Homeland Security, and so forth. So, I mean, we were facilitating enrollers for 14 years, and we have, I really have to say that in addition to the benefits for someone to get health insurance and utilize preventive care and all that, in terms of systems efficiencies, I really have, and I don't know where down the road this will be assessed, but compared to how we were, the application process for people to get Medicaid and Child Health Plus in the past, or private insurance, where you really have to, it's a lot of documentation, it's managed care plans for Child Health Plus, it's DSS offices for Medicaid. The fact that you now have a centralized place where people get health insurance, I really do believe that there will be some gains, some financial gains, in terms of increased efficiencies down the road.
Yeah, I saw on the screen earlier something that appeared to be a little unfair. Why is it that families in Westchester County earning the same amount of money as families in, let's say, Brooklyn, have to pay more money to join the plan?
Again, as I emphasized during the slide, the insurance rates are set by county. They're set by the Department of Financial Services. So they vary by county. Also, the health plans vary by county. So not every health plan that you see in Westchester County is in Albany County or in Kings County, for the examples that I provided earlier. And so the health plans also may charge, their rates vary from plan to plan. So again, those things account for some of the things.
Car insurance,
it's like our taxes, Joe.
The truth of the matter is, even your car insurance varies by the county that you live in. So when I moved from Albany County to Schenectady County, my insurance went up. Okay?
Yeah, I didn't understand that either. But I have a feeling that based on I have a feeling that it has to be based on what the insurer, because it's the insurer who sets part of the rates, or just by.
So the insurers, they submit rates
Yes.
to the Department of Financial Services,
And they request by county what they would like the
Right,
rates to be.
and I'm sure there are tons of factors that go into those, income levels, population,
Exactly.
all sorts of things that go into it.
Income level, right.
And also from a governmental end, I will add that the more people that sign up for the marketplace, the cheaper the rates are going to be.
Yes.
So bear that in mind. The more people that sign up to the marketplace, the less you're going to pay. And also, it's also been documented that in those states that did buy into the marketplace and are getting those federal subsidies, insurance policies in those states have gone down by 50% because now they're all competing for your business. So healthcare is a lot cheaper.
Okay. Now, on that same note, I'm going to follow up with a question. We have a few minutes to go. So, once the rates are set, and let's assume someone signs up today, they may be, they know what their rates are. What happens next year?
So that rate is good for 1 year, okay? And so next year, they'll go through another process of evaluating rates, et cetera. So when you enroll in a plan, the rate that you're quoted is good for 1 year.
Now, the rate actually can go, most likely will go up rather than go down, but it probably could.
Well, that depends on the number of
The more
factors.
people, yes, the factors.
The number of well people, young people, healthy young people that are enrolling versus the, if the entire population of people enrolling are sicker population with more demand on the healthcare system, more expended medical healthcare expenditure, then certainly we can expect the cost to go up. That's why it's been so important. We've had so many efforts underway to try to get what are being named the young invincible populations to enroll. So individuals under the age of 35, 18 to 35.
Do they have a mobile app or something?
We don't have a mobile app here in New York State. Young Invincibles nationally may have something, but that's not something that New York State has subscribed to. So
then at the end of that year, it's become, so there's a rate adjustment, so the insured is still making choices, or is it chosen by the insured?
So again, the insurers, they submit rates to the Department of Financial Services, who has to say yea or nay based on various factors. They have actuarial analysts or actuaries who kind of go through all of that information, but and then they'll come out with, and they'll set rates for the next year and put those out, officially announce those.
Yeah, and I believe that the rates are not, it's going to be a process where they have to demonstrate that the rate increase is a reasonable increase.
Right.
And I believe you also have situations where the insurer has to report their, their loss experience, so that the rate setting body would know, well, are you losing a lot of money or are you making a lot of money on these insurance policies? I guess that would factor into whether you would grant a rate increase or deny it. So there's not a process where the insurer can turn around and just raise the rate.
No, again, it's regulated by the Department of Financial Services.
Very tight
certainly
regulation
want to make sure that what's
part of that.
the rates, if the insurer decides that they want to increase their rates, the Department of Financial Services is going to evaluate that to make sure that it's a fair situation. So all of the things that go into that, I'm not certain of, but.
So I understand, so if there's an adjustment of the rate, that does the insured have then a choice to say, well, I want to come out of this plan and choose something else?
Okay, well, you'll have a new open enrollment period. So every open enrollment period, you can make changes to your plan. So sorry if I misunderstood your question earlier.
Last question.
It's more of a statement than a question. I wanted to say thank you to Legislator Williams and to you, panel, for making this presentation so simple. I was petrified to even look at the side door, read any of this. It seems so much.